Morgan Jericho from ODHH opened the meeting and introduced Shane Feldman and Sam Woltz from Innivee. Innivee is now subcontracting with VividCo, which is the Washington-based company ODHH has selected to contract with. VividCo has a track record for working with Washington legislators and government-related activities. However, they are not experts with deaf, deafblind, and hard-of-hearing ASL users. So, they are partnering with Innivee, which is a deaf-owned and deaf-run company specializing in strategic planning, organizational development, and leadership. Innivee has worked with other states on similar projects such as ours. During the first hour, workgroup members provided a summary of the action plan, which is also outlined in the attached PowerPoint. During the last hour, there were questions. Question number 1. How much money is this project going to cost? Washington State is in a tight budget situation now. I am a little concerned about that. Will the outcomes of this project help us generate equal compensation in quality of services or cost-saving measures? The answer. The proviso funding was passed by legislation in spring 2024 legislative session. This is a separate budget from the overall state budget that is going through state evaluation on how to allocate funding. The funding for this project has been allocated to ODHH to utilize for fiscal year 25 and fiscal year 26. Question number 2. Will the focus groups and/or subgroups be in person in any specific location or in people's homes? The answer. Focus group interviews will take place per the participants' agreement with Innivee team. This is pending budget reallocation approval as of December 19th, 2024, publication of this information. Question number 3. When the final solution is established, an ITP for example, how will this prevent interpreters from joining VRI, Sorensen, Purple, etc. in lieu of an ITP to pursue a source of stable income? This is one reason we are losing freelance interpreters now. The answer. While some interpreters are switching over to VRS and VRI for stable income, we do not have data that shows we are losing interpreters. The data we have shows that the number of requests has tripled after COVID. ODHH has the same number of interpreters for a period of 7 years. Question number 4. Will ODHH be able to promote the focus groups interviews opportunities using social media websites? The answer. Yes. ODHH has a new web page to post updates about process. We also will share updates through Gov Delivery. Please sign up for Gov Delivery updates if you are interested. We will be sharing our content to the community organizations for communicating with communities across the state of Washington. Question number 5. My understanding, HB 2221 is one of its kind, first nationally. Is this being treated as a national pilot? Any plans to collaborate with Pennsylvania as they passed HB 2566 to address their shortage? Answer. This is not the first of its kind. Other states have already received legislation reports. These states are Minnesota, Arizona, and Louisiana. We are in touch with other states with a similar model to assess how to best put information collected in this work group to implement solutions. Question number 6. Legislators are not interested in hearing our personal and private stories. They need data. Will the team be gathering that data and looking onto Fortune 500 companies for comparison? The answer? Quantitative and qualitative data have similar impact on the understanding of this complex issue. We will attempt to collect data from private businesses, but due to the current laws and regulations, private businesses have their proprietary rights to protect their information. This data may or may not be incorporated into the legislative report. Question number 7. What are ODHH's plans to follow through with the report, especially at the legislative level? Can you give examples of what we, ODHH, can do to work with legislators? Answer. We will work with the ALTSA, A-L-T-S-A, legislative team to provide technical guidance to the legislators. ODHH's operations are impacted by this issue. Therefore, ODH will make testimonies as appropriate during the legislative process. We will provide legislative training upon request to the community to be able to gain a better understanding of the community's role in the legislative process. Question number 8. Is it possible to send the public a list of questions Innivee will be asking the focus groups and interviews for full transparency as soon as possible for this time period of recruitment? This could help everyone get a better idea of what kinds of questions are being asked in addition to what can be discussed and brought up. The answer: we are unsure at this time and will post further information on this update. Comments shared. The legislative report will be ready for distribution by July 1st, 2025. The ASL version of the report will be distributed by approximately September 2025. The legislative report will provide critical information to the legislators and to the community to determine the best course of action and implement solutions to address this crisis. Stories shared by the community has been brought up several times. These stories have not been documented in the past. This work group will be the opportunity to document these stories and to quantify it into a framework that is easily comprehensible by stakeholders. As of 2024, there is one interpreter training program in Spokane Falls Community College. The focus of the ITP program is on educational interpreting. This is a specialized training for interpreters to go into the education fields. However, there are no ITPs in Washington State that provides training to interpreters to specialize in different fields such as legal, medical, employment, and community interpreting. For this work group scope, we will be focusing on community interpreting solutions. There is a serious need for high-quality interpreting services in East Washington, and we are looking into different possibilities. The Innivee Strategies team consists of Shane Feldman, CEO and facilitator. Pronouns: he, him, his. Sam Woltz, Workgroup Leader and Facilitator. Pronouns, she, her, hers. Melissa Elmira Yinkst, Facilitator. Pronouns, she, her, ella. Gavin Searles, Facilitator. Pronouns, he, him, his. The overall project goal is to create a legislative report which will propose solutions that support access to communication by increasing the number and availability of signing, protactile, and trilingual interpreters in all communities, including rural areas and historically marginalized populations. Project roles and responsibilities. There are 4 entities involved in this project, each with their own roles and responsibilities. The first is the work group. The work group will be responsible for contributing and discussing unique perspectives, related experience, and developing recommendations for the project. Innivee. Innivee will be responsible for planning and facilitating the work group, as well as collecting and synthesizing data and work group recommendations. VividCo. VividCo will be responsible for the project management, conducting research, analyzing data, summarizing findings, and drafting a legislative report for submission. ODHH, the Office of Deaf and Hard of Hearing, will be responsible for overseeing the project and has decision-making authority. Work group objectives and recommendations. Recommendations will include training and certification standards, increasing signed, protactile, and trilingual interpreters across all communities such as rural, BIPOC, protactile, CDI, DI, LGBTQIA, and other specialized fields. Strategies to increase professionalism development for interpreters, and pathways for interpreters to be financially supported statewide. Work group members, along with Innivee Strategies, will work together and be responsible for this work. Subgroups, roles and responsibilities. There are 4 subgroups involved in this project. Subgroup A, licensing and certification. How can we ensure that interpreters have the right skills to provide quality services? Subgroup B, supply and retention. How can we increase interpreters, including in rural areas, minority groups, CDI, DI, and trilingual interpreters? Subgroup C, education and professional development. How can we establish vibrant ITP programs, apprenticeships, and mentoring, and professional development opportunities? Subgroup D, financial support. How can we develop financial pathways for interpreters to live and work? Work group timeline. We are now in phase 1, the kickoff and preparation phase, which is November to December 2024. During this phase, overall project goals will be established and roles and responsibilities will be defined. Phase 2, during January to February 2025, work groups will begin data collection. Subgroups will conduct community-focused interviews and create recommendations. Phase 3, February to March 2025. Data analysis. Here, data will be analyzed, synthesized, and priorities will be determined. Phase 4, March 2025. Data delivery and closeout. During this phase, themes and findings will be identified and a comprehensive presentation will be delivered. Phase 5, April to May 2025. Final report and closeout. Vividco will submit the final legislative report and close out the project. We need you. If you're interested in sharing your perspective or experience, we invite you to participate in our focus groups or interviews. You can contact Innivee Strategies at wwg@innivee.com.